I'm Dr. Hassan, board certified trauma anesthesiologist. You're scheduled to have surgery. This is probably the second scariest day of your life, the first being the day of surgery. You've already met with your physicians. They've already given you your instructions. I'm a board certified anesthesiologist. Let me help you by giving you some tips that I've picked up over my years. Now, what you need to know is 99% of surgeries are all done the same exact way. What do I mean by that? Well, if you're getting your gallbladder out, if you're having a hernia repair, if you're having back surgery or shoulder replacement, 99% of the time, the surgeons follow the exact same script for the surgery. Now, what determines whether or not you have a good outcome or a poor outcome is whether or not your body and how your body reacts to anesthesia. Now, what do I mean by this? I mean, it depends on your health, other comorbidities, and the type of anesthesia you're getting. Here are 5 tips that I've come across that normally aren't mentioned by your physician when they give you the instructions on what medications to take, what to do before surgery, what to do after surgery, and so on. Number 1, if you're a male, you want to do your best to shave before surgery. Why do I say this? It's because when we induce anesthesia, you go to sleep. There's a short period of time where we have to ventilate you before we place the breathing tube in your trachea. If you have a beard, this makes ventilation a lot more difficult. If you are obese, it makes ventilation even more difficult. So if you're obese and you have a big beard, that puts you at higher risk during that short period of time after we induce anesthesia before you get the breathing tube. So if you shave, we can create a much better seal around your lip with the mask that we put on your face. Number 2, if you're a smoker, you want to do your best to kind of quit smoking about 1 month before your surgery. Why do I say this? Because when you smoke and you go under anesthesia and we give you the anesthesia gases into your lungs are what they call as hyperreactive. It means after the breathing tube is in and the gas is in your lungs, it causes mucus secretions, causes you to cough, and it causes you to have difficulty breathing. So if you can quit smoking a month before, switch over to Nicorette gum, that will not only help with your breathing during anesthesia, but your wound recovery after the surgery itself. If you can't do 1 month, try for just 2 weeks. Number 3, electrolyte optimization. What do I mean by this? Electrolytes and glucose as well. So you want to do your best before surgery, for your day of surgery, the weeks leading up to your surgery. Try to eat healthy. Try to get your electrolytes in balance. So stop drinking sugary drinks, stop drinking sodas, start drinking water, electrolyte drinks, not Gatorade, but electrolyte drinks, and try to optimize your body the best you can before you go into surgery. This means that the day of surgery, when they check your labs, the electrolytes will be normal. This will give you a better chance of having stable blood pressure during surgery. Now, having a soda before your surgery is not going to kill you. If you can and you want to optimize your body, think of it almost as if you're training for a marathon. You want to get your body ready for a sprint. Hydrate properly, hydrate adequately, hydrate safely. Number 4, what can you do with protein? So before your surgery, after your surgery, it's not mentioned by most physicians, but you want to increase your protein load if it's safe to do so. What do I mean by this? Not only protein drinks, but maybe chicken or more steak, those kind of things, when you can eat it, it will increase the amount of protein in your body. After you go through any stress test, let's imagine you go through a marathon, you're going to have a lot of muscle and tissue breakdown during that stress test. The adrenaline your body releases will also cause muscle breakdown as well. So what do you want to do? You want to try to optimize your body and give it as much fuel as you can. So that's not only eating healthy, but also optimizing your protein intake. More protein, better recovery before and after surgery. If it was me having surgery, I would drink a protein shake before, the day before, and a protein shake as soon as I can after surgery. But that's just me. You're going to be different. And number 5, during surgery, after you go to sleep, if you're going to get the breathing tube, we're going to have to extend your neck the best we can when we place the breathing tube. Now, what can you do to kind of optimize and increase your chances? Well, you can practice some neck stretching. This muscle right here, the platysma, is the one that causes the most restriction when you extend your neck up. If you can, try extending it to the right, left, up, and down. Giving a little bit more flexibility to your neck before your surgery can be the difference if we can place the breathing tube, if we can't place the breathing tube. If we can't place the breathing tube, the risks are catastrophic. But this will not determine whether or not we can and can't place the breathing tube. It just helps the chances if you have a little bit looser neck. That's all. Now, I want to thank you for watching these tips. I want you to save these tips. If you know anybody who's having surgery, maybe this might help them. It might help their recovery as well. So to go over the 5 tips again, number 1, do your best to quit smoking. Number 2, try your best to optimize your electrolytes and glucose. So try not to eat a lot of fatty, sugary things before your surgery because that will impede your ability to heal after surgery. And your electrolytes being optimized before surgery and during surgery will help your heart beat during the surgery itself. Number 3, optimize your protein. Try to have some nutritious meals that have extra protein than what you're used to eating before your surgery. And after your surgery, try to increase your protein intake too, because your body needs to heal and needs protein to heal. Number five. The next one off the top of my head, try stretching out your neck. So before the surgery, if you can, if it's safe to do so, do some exercises with your neck, try to roll it around and get some fluidity to your neck. This will help with the intubation process. And number 5, so that last one was 4. Number 5, if you're a male, do your best and shave before surgery. I can't tell you how often it is that I see somebody with a big beard, and in my head I'm like, oh man, this can be what they call a difficult intubation. If you can, do your best, shave completely the day before your surgery. Now check this channel periodically. Every week I'm going to do my best to upload a video with a different surgery and break down little tips in and out of the surgery that can help you do well during your surgery. Also, we'll do some other shows as well. Do me a favor, leave some notes in the comments. Please give me some constructive criticism. And in the comments, if you want to see a particular surgery covered, if you want to see a particular medical topic covered, just leave it in the comments below. Thank you so much. Thanks for tuning in. I'll see you on the next one.